Hi, my name is Mrs. Carmack, and I am going to be doing a presentation on an ethical dilemma, and this is part of Nursing 3350, Ethics, Legalities, and Advocacy. We're going to be talking a little bit about a nursing dilemma, and the first thing we do is to give you a hypothetical case study. Is a white male child who was born to a 20-year-old diabetic 2, para 1 mom. She went into preterm labor. She has had prenatal care. She was delivered via vaginal birth. Her birth weight was 1,100 grams. And at birth for 1 minute of 3 and at 5 minutes of 5. He was intubated and he did require intensive cardiopulmonary support. At 6 hours of age, he was transported by air ambulance to level 3 NICU. He was diagnosed with respiratory distress syndrome and following pulmonary surfactant therapy. He also was diagnosed with hydrocephalus, a day of life 14, a ventricular peritoneal VT shunt was performed at day of life 16, and the VT shunt was treated at day of life number 55 and was replaced. Bacterial meningitis was developed due to Staphylococcus epidermidis on day of life 105. So the ethical question is now day of life 106, and you are the nurse at the bedside for John Doe. The mother will correctly ask you and ask, will my baby be normal? The ethical dilemma is how do you answer this mom's difficult question? We've learned in class that there is a model for making ethical decisions. It's a moral model, which is massage the dilemma, outline the options, review criteria, and resolve, affirm position and act, and look back. We can talk about massaging the dilemma, and what that is identifying the dilemma. And the dilemma is that you have a mom with about 29-week preterm newborn who's not day of life 106 that has a history of intubation, surfactant therapy, hydrocephalus, VT shunt placement, VT occlusion, and bacterial meningitis. To ask the question, will my son be normal? It's important when you do massage the dilemma that you recognize that there are many components. And some of the components of this dilemma are how much information should mom be given at this time? What is the definition of normal, if there is a definition? When should mom be given this information, and who should be present? It's also important to gather facts relevant to this ethical decision. And some of those facts are, what is the prognosis for a 29-week preterm newborn? What's the prognosis after surfactant therapy, hydrocephalus, VT shunt prognosis, the prognosis for VT occlusion, and bacterial meningitis. You also have to identify the stakeholders in this particular dilemma. And the immediate stakeholders are the bedside nurse and the mom, but there are other stakeholders, and it's the healthcare team, the other members of the family, such as the father and extended family, and ultimately the infant. After you massage the dilemma, you outline the options, and there is a way to outline the options where you look at the immoral and illegal options, you look at illegal and moral options, you look at moral and legal options, and you look at legal and immoral options. And again, we're going to toss out all of those others and just consider the moral and legal options. Now that we've looked over our options, we're going to review our criteria and resolve. So we removed any option that was illegal or immoral, and 4 options remain that are moral and legal. The first one is to suggest that the mom speak with the doctor. Well, this is not exactly a good choice. There may be reasons why the mom is asking the nurse and not the doctor. She may be more comfortable with the bedside nurse, and she is expressing a need for information. By not answering this information, the nurse is not practicing beneficence. and beneficence is doing the most good in the least time. The second option is to ask the mom the exact concerns for bringing up this question at this time. And this is possibly a good answer because it gives the mom an opportunity to talk about what her concerns are right now. And this is practicing autonomy. And autonomy is in the respect of rights and the dignity of all the stakeholders. The third option is to ask the mother if we can schedule a better time to sit down and talk with the whole treatment team. And this is possibly the best answer because it incorporates beneficence, autonomy, and justice promotes the common good. And then the next option is to tell the mother that the evidence does suggest that her infant may have cognitive and physical delays. And this is possibly a good answer. It's honest, factual. When you give the mother that information, it is important that you remind her that even though the evidence does suggest this possibility, we do not have the exact answer. I would use this response. And after I use this response, I would suggest a team meeting to have the most up-to-date information presented to the family by all members of the health team. The next part of the moral method is the affirm, position, and act. And the bedside nurse, when she answers the mother's questions by stating that the evidence does suggest there will be delays and not always the case, she answers the mom's questions. She's also going to ask, can she schedule a meeting? So after the discussion with the mom, a meeting is scheduled between the family and the healthcare provider. And at this meeting, family again is encouraged to voice their concerns. The family's questions are answered honestly, thoroughly, and satisfactorily to meet all their needs. And the family is encouraged to verbalize their concerns. Information is provided through printed material as well as through verbal exchange. In summary, the final step of the moral model is to listen back. And the bedside nurse is able to look back on her behavior and recognize that she has followed the ANA code of ethics. She has considered her own personal and professional values as well as the values of the patient family. She's also involved with other members of the healthcare team in her patient's care, and she has gained respect with her coworkers. She feels successful in solving this dilemma. This process turned out well for this family. They learned they could rely on the nurse to give them honest information about the care of their child, and that they were treated with beneficence, autonomy, and justice.